Get closer. Hello, everyone. My name is Starquasia Kirkman.
Hello, my name is Golda DeWongui
And I'm Doris Osagai,
We all attend Coppin State University,
here in Baltimore.
Maryland.
and today we're going to be talking about evidence-based practice and how you can use it in informatics and specifically in nursing care.
And we're also going to talk about why it's important.
And also student role in evidence-based practice in nursing.
Okay, so evidence-based practice is using research to find out information and not just going based on what you know. So you shouldn't just do something because you see that it has always been done that way. We should be able to research everything and make sure that these are proven facts in deciding why we choose to make certain interventions that we do make or do things that we do.
So as Star just said, it's important being in a hospital setting to be able to back up whatever you're doing, to be able to have an actual research that was done to actually back up whatever you're doing, not just saying, oh, that's what my grandma said and that's why I just usually do it this way. And it's important to be able to know how to validate the information on a website, how to make sure a website is actually a good website, so you need to check your sources and all that stuff.
And as a student, it will be wise for you to be able to know how good to use evidence-based practice, whether in school or at your clinical site. So the best thing to do as a student, when you go to your clinical site and you have a topic or perhaps a disease process that you do not understand, there are information in the hospital setting that you can search for this the disease and what to do and how to go about it. And when you're not satisfied, there are other documents that you can go and search, and get the actual information that you want.
So basically, we're trying to break away from doing things a certain way just because they've always been done that way. It's time that we actually back up our practice and not just do it because that's what we've always done. We need to just break away from that.
An example of this would be something such as growing up, we may have been taught if you get a cut or a scratch on your arm, you should lick it or something like that to stop the bacteria from getting in. But now as we have grown and we research, we know that that's not evidence-based practice. Those are just customs, which can be different according to people's culture. But you want to use the web and the information and all the resources that you have available to you in order to find out the best way to take care of your patient. If we just do things the way we think it's going to be done, there's going to be no one set way that things are done, and everyone will do things differently. So another benefit of evidence-based practice is that we all come to one agreement on how to take care of patients, the best way to incorporate these things into our care. So we should really just look up our information and use all the data and facts that we have available to us, with the internet being one of the main ones.
And the fun part of evidence-based practice is that new information come up every day. Research is a continuous process. So what they do is that what you know last year concerning the disease process must have changed 6 months ago. That is why it's always wise before you go ahead to treat anybody or give any information you know about any disease process. Check for the recent researched evidence-based practice on how to go on how to go concerning the disease process, and you'll be amazed about the recent information that you will find concerning that disease.
And also, with that being said, keeping up with whatever evidence-based practice there is also helps with patient safety, because you don't want to do things on your patient that have been already outdated. You don't know if you're putting your patient at risk for an infection or anything like that. So it really helps to stay in your scope of practice because you already know what it is that you should do, and you can back it up just in case you do get in trouble or anything like that. You can back it up with actual research, so that's helpful.
So I know we said this is things that nurses do, but as nursing students, what do you ladies think that we could do now, or what are we already doing as far as in our clinical setting and as far as learning in classes? How are we using evidence-based practice already and incorporating the internet and the web into that, like as nursing students?
For one, we use our books and make sure that whatever we do read online does kind of match what we read in our books. You don't want to just try something on your patient because they're human beings, they're not puppets. You can't just try whatever you want to try on them. So you need to make sure that whatever you're doing is supported by your books and research that you find online. Because even though we're not full nurses, we're still liable for whatever we do in hospital settings. So.
And in addition to what you've just said, it's also wise that while we are comparing information concerning our evidence-based practice, it's always wise that whatever new information that we have, we also have to verify it. Have they used it before? What was the outcome? Before you, instead of you just jumping into using the new information, you have to find out what has been done concerning that research. And with that, will make a better student nurses.
Yeah, and also we need to remember that every patient is different. Whatever works on one patient is not necessarily going to work on another patient. So you need to actually do your research, go out of your way to find out, oh, this worked on this patient because of their age and their weight and their height perhaps, and then what's going to work for another patient is going to be different. So really, we're more than just the bedside nurses. We have to go like beyond what is expected of us and do the research.
And also, as nursing students, now we're experiencing, if we're in a clinical setting and a nurse or a doctor has an order for a patient, such as give the patient this medication or that medication, we don't just go and do what they say. We make sure we find out what that medication is for, make sure we understand how to give it. We use our researchers to figure out why they may be taking this medication. Is this the best medication for them? And we're not just going to go and do something because we were told to, because we are also liable for these patients, and we also need to keep them safe and make sure we understand why we're doing what we're doing.
Absolutely.
And it's really been fun making this video, and I really wish we can go on and on, but we gotta stop. And
so thank you guys for joining us. Thank you for watching, and use your evidence-based practice, use your research, and just do your best to take care of patients. Thank you.
Bye.